What if the signs of a really serious health condition in your teenager looked, well, just like normal teenage stuff? Today, we're going to talk about adolescent diabetes. It's a condition that's way more common than you might think, and one where spotting the subtle clues can make all the difference.
This quote from Dr. Chomi, a pediatrician, really hits the nail on the head. We're not talking about some rare disease here. Adolescent diabetes is common, but it's so often missed. And that gap right there, that's what we're going to try and close today.
So let's do that. Let's drag this under-recognized health risk out into the light. Because honestly, when it comes to a kid's health, knowing what to look for can literally change everything.
Okay, so first things first, what even is diabetes? Well, it all comes down to a hormone called insulin. You can think of insulin as a key. Its job is to unlock our body's cells to let sugar in for energy. Diabetes is what happens when the body either doesn't make enough of these keys or the keys it does have just don't work right anymore. Now, when we talk about diabetes in teens, it's not a one-size-fits-all kind of thing. There are actually two main types we really need to get our heads around. Let's try an analogy. With type 1, think of the body's immune system as mistakenly attacking the factory that makes the insulin keys. The factory just gets shut down permanently. With type 2, the factory is still working, but the locks on the body's cells have changed, so the insulin keys don't fit as well. And frankly, we're seeing this second type pop up in younger and younger people.
And let me be absolutely clear about something, because this is so important. Type 1 diabetes is not caused by eating too much sugar. It's not caused by being lazy. It's an autoimmune condition. Getting that fact straight is the very first step to dismantling the really unfair stigma that can come with this diagnosis.
Okay, so this brings us to the most critical part of this whole explainer. Knowing the early warning signs is what saves lives. It's that simple. So, what are we looking for?
And yes, this is me talking directly to you. If you are a parent, a grandparent, a teacher, a coach, anyone who cares for a young person, this next part is for you. I need you to lean in here.
So, these are the classics. Here's what's happening. When sugar can't get into the cells, the body tries to flush it out through urine. That means more trips to the bathroom, which leads to dehydration, which causes this crazy thirst. The body thinks it's starving, so hunger goes through the roof, but the person is actually losing weight. And without fuel, you get fatigue, irritability, even blurry vision. These aren't just personality quirks. This is the body screaming for help.
And here's a super specific one that gets misinterpreted all the time. If you have a child who's been potty trained for years and they suddenly start wetting the bed again, that's a massive red flag for diabetes. It is not just a behavioral problem. The most crucial takeaway here is this. Please do not explain these symptoms away. It is so easy to say, oh, they're just stressed, or it's just a teenage phase. But when you see these signs pop up together, it's a clear signal that it is time to call the doctor.
Now for the good news. The really good news is that once you recognize it, diabetes is absolutely manageable. But it's not a solo mission. It takes a team.
And that first step, it's surprisingly simple. A basic blood sugar test can give you a clear answer. It's not some complicated, scary procedure. It's fast and it's definitive.
And managing this, it really does take a village. It all starts with empowering the teenager, of course, but that support system has to include the family, the doctors and nurses, and even the school community. Everyone has a role to play in keeping that young person safe and healthy. And inside that support system, the emotional part is, well, it's everything. Think about it. Getting this kind of diagnosis as a teenager is a huge deal. They need empathy. They need understanding. They do not need judgment or blame. That support is just fundamental to their well-being. Which brings us to our final and honestly most hopeful part of this whole thing. A diabetes diagnosis is not the end of a young person's story or their dreams. Not even close. It's about learning a new way to thrive. So how do they do that? Empowerment is all about knowledge. When a teenager learns how to check their own blood sugar, when they start to understand food and how it affects them, when they can recognize the signs in their own body, they stop being a patient and start being the expert of their own health. And that sense of control, it's transformative.
And let's be crystal clear. Living with diabetes does not mean giving up on your dreams. I mean, there are professional athletes, brilliant doctors, amazing artists, leaders in every single field who manage their diabetes and live these huge, incredible lives. And this is a direct message to any young person out there who might be listening. You are not alone. This is not your fault.
And with the right care and the right support team, you can and you will live a long, healthy, amazing life. So, let's just bring it all back to the single most important message we have here today. Early recognition saves lives. Pay attention to the young people around you. Trust your gut. Please, don't ignore the signs.
And that leaves us with one last question. We've talked about the problem, the signs, and the path forward. So now that you have this knowledge, what are you going to do with it? How will you help protect the young people in your world?